Riverside Healthcare puts the health and wellness information you need well within reach.
This is Carl Moronich. The opioid situation has grown to a national crisis. We talk with Riverside Healthcare Senior Vice President and Chief Nursing Officer Michael Mutterer, himself an experienced addiction counselor, about the current epidemic, the struggle with addiction, and how Riverside is working to help solve the problem in our community. Join us for a frank and important conversation.
Riverside Healthcare puts the health and wellness information you need well within reach.
And we are joined by Michael Mutterer. Michael is the Senior Vice President and Chief Nursing Officer at Riverside Healthcare. Michael, welcome.
Thank you. Glad to be here.
Glad you're able to join us on the podcast. And today we're going to be talking about opioids, which has become a real crisis, not only locally, but nationally. It's really an epidemic. And want to talk a little bit about how Riverside fits in to hopefully helping with that situation. But let's start with a little bit about your background. I know you have a background in addiction.
I do. I'm actually a board-certified and licensed clinical therapist, as well as a certified addictions counselor and a registered nurse.
Oh, so kind of have a vast background in this.
Yes.
And your role at Riverside as a vice president, chief nursing officer, deal with all the nursing situation, a variety of things here at Riverside.
Yeah, definitely. One of the service lines that actually reports directly up to me, in addition to the nursing, is the behavioral health services line, and part of that service line is our addictions specialty areas as well. So I do still be able to get some touch points with behavioral health and addictions here at Riverside.
And when we talk about opioids, tell us exactly what group of drugs that is.
Sure. So when we talk about opioids and we look at it from a perspective of the national epidemic that we're looking at currently, we really look at it at a couple of different angles. So one being the heroin piece to this, so the illicit drug. The second being more the prescription drug opioids, which are typically a sort of lead into potentially getting into heroin use, and really both arenas, whether it's illicit or prescription drug use, can really cause some issues for people who are not using the prescription drugs as prescribed, and certainly anybody who has gotten into use of heroin.
Sure. Now, by their nature, is this an especially addictive drug, more so than others?
You know, addiction in and of itself is a disease, and I think if somebody is prone to addiction, certainly opioids are a very dangerous drug to tamper with because they are very addictive. So, you know, every day we see 115 plus Americans die from opioid use or opioid overdoses, and you know that's a number that's pretty staggering. So if you think about that, somebody who has started their path down opioid use, whether it be from the prescription side or the illicit drug use and using heroin, there is a high propensity for early addiction and a high propensity for sort of escalating their drug use. So as we talked about, from prescription medication potentially onto the illicit form of opioids, which is, again, heroin.
Yeah. Now, you outlined your career and the things you've done with addiction counseling. It seems that every so many years there's a drug of choice that becomes an issue. Cocaine some years back, and now opioids. Is there a reason that it happens that way?
I'm going to say supply and demand. I think that when drug addiction hits, it really is about what is an easy source for a high, and I think when the demand or the supply outweighs each other, certainly at this point, it's sometimes cheaper to get a hold of heroin than it is to find other sources of highs, and so I think that definitely plays into this epidemic at this time.
And right now it is opioids, and this I think 56 deaths in Kankakee County last year in 2017, and you mentioned 115 Americans a day are overdosing and dying. So it is a problem. What is Riverside? How are we positioned? How is Riverside positioned to help the community in the midst of this?
Absolutely. From a treatment perspective, we opened late 2017 a new department that is adjacent to our emergency department, which is our behavioral health central intake department, and really a team of specialists that are located here at the hospital in order to do screening, assessment, and referral, and really be able to help people get to the level of treatment that they need based on a full clinical assessment. So that's probably our easiest access to treatment and care. But we also have a number of different areas that are focused on actual treatment. Our Resolve Center out in Manteno is really focused for that young adolescent boy population, so ages 12 to 18. And is a residential treatment setting to really work with those young boys who have not made it in outpatient counseling settings or other types of treatment programs, as well as a full gamut of outpatient programs that are designated to working with people with all levels of addiction and really from all different addictions as well. So not just looking at opioid addiction, but looking at alcohol, marijuana, any other type of substance dependence that could occur as well.
And is the treatment similar for any addiction?
It is. I think, certainly the goal is to have abstinence. That's the ultimate goal. But as an addictions therapist and counselor for a number of years, we know that it's a process, and every day is a struggle for people who are dealing with addiction, and every day is a new day to wake up and say, am I going to use today or not? And really, through the counseling process, helping individuals find tools that they can utilize each and every day that help them make that choice to hopefully stay clean and sober. But the basic principle is the same, no matter what the chemical is or what the substance is of choice.
Now, what do you say to an individual who is in the throes of an addiction, and they wake up, as you said, now you've got a choice today to use or not to use, and you think, I just don't see a way out of this. It's not going to be an easy fix, so I'm just going to keep using. It seems like a hopeless situation, really.
We really focus, and again, depending upon the treatment program, but there is a focus on that one day at a time philosophy. As people go through withdraw and eventually become the early stages of being clean and sober, it's daunting to think that it's a lifelong process. And so really helping people focus on making that determination or making that decision each day as to whether or not, today is a day that you can remain clean and sober. And sometimes that day to day might even be minute to minute, and really helping them break that down because it can be overwhelming thinking about a life of being clean and sober.
Yeah. And when you're at the bottom, it's tough to see your way out and to see that light at the end of the tunnel, I'm sure.
It really is. And I think a lot of times, people, even looking at the disease process itself, there are various different reasons why people, start using drugs and alcohol. For teens or people that are starting early in life. I mean, it can be not fitting in at school. It can be breaking up with a boyfriend or girlfriend. It can be depression. It can be early onset of mental health issues that they're just compensating for, not wanting to speak to their parents or physicians regarding mental health issues. So there's a variety of reasons why people may start using drugs and alcohol, and the addiction becomes secondary to that. For adults, very similar. I mean, it can be a triggering event that somebody starts using, and if that addiction piece is there, they aren't able to stop. People drink socially. People are able to have one drink, two drinks, and walk away from it. But that addiction mindset, and whether it's with alcohol or opioids alike, that addiction is the inability to be able to stop that usage.
If you have someone in your life who you think might be having addiction issues, how do you recognize that?
There's a number of ways that you can recognize it. People who are, again, unable to stop. So if they, first of all, if we talk about alcohol, I mean, because it's legal and something that, is socially acceptable, a person who's doesn't have that ability to be able to stop. So every time they drink to excess. It may start affecting areas within their life. So whether it's personally, marital issues, issues with their children, certainly we will see employment issues many times. So not being able to get to work on time because they can't get up. needing to leave work early. Some people stash alcohol in their drawers and, use that throughout the day. When you're talking about illicit drugs, I mean, certainly, you can't take a break and, go shoot up heroin. It's a little bit different. I mean, as you start seeing the use pattern, so if you know somebody is, say, taking prescription opioids and not following the prescription as the physician ordered, so if they're taking it for a specific pain and that pain to them is not being resolved by the dose that the physician is prescribing to them, they'll start taking double the dose or extra pills in order to start to feel what they feel is relief for that. So again, using that prescription opioid outside of the parameters of what it was initially prescribed for. When we're talking about heroin, I mean, again, that's an illicit drug. It's an illegal drug. And again, somebody who's using heroin, I don't believe that there's a recreational use for heroin myself. So I think as an addictions counselor, somebody who's willing to go into that level of a substance really puts themselves at risk, is, in my opinion, a person that needs to seek help. So again, if somebody sees issues within that person's life, the ability to be able to try and get them to a facility for a screening and assessment, and then again, that determination of what level of treatment they need is critical. They're not always willing to do that, though.
Sure. I'm sure in many cases not.
Many cases not. And the one thing about addictions treatment is it is not something that we can force upon somebody. So if they are interested in wanting to get information and wanting to enter into some type of a treatment program, whether inpatient or outpatient, that's the time to strike. Many times people will start treatment and leave treatment. People will start outpatient counseling and for whatever reason, if they've hit rock bottom, if they've had a event in their life that has caused them to need to seek out counseling, if they waver in that addiction cycle, many people go through treatment multiple times in order to conquer that addiction.
Is there value in the family? If we have someone in our family who's got this addiction issue, they're not willing to seek help. Is there help for the family, independently of that individual, to try to deal with this and hopefully ultimately get that family member the help they need? Yeah,
absolutely. When you say if you have a family member, I'm gonna say most families have some level of addiction within it, and unfortunately, addiction crosses all boundaries. So race, age, sex. So most of us know somebody within our family or close circle who possibly struggles with addiction, and I do think that there are avenues for affected others that can help them cope with the addiction itself.
Affected others, that's the term for it.
It is. So I mean, if you think of there's a number of different groups that are out there that are for adult children of alcoholics, or adult teens of alcoholics, or spouses of alcoholics. So again, that sort of affected other can be that immediate family. It can be coworkers. It can be friends. But there are support networks out there, and typically those support networks are other people who have been affected by people who misuse or abuse drugs or alcohol.
We started talking about opioids, kind of went into addiction overall, but bringing it back to the opioid situation. I know Riverside is involved with a number of organizations throughout the community. How are we partnering with some other organizations and agencies to affect that positive change?
Sure. We have started a task force here at Riverside that has brought a number of leaders from Riverside to the table to indicate from the area of oversight that they have how opioid dependence or opioid use has affected the areas in which they oversee. And also to that table, we have brought partners from both the city and county to help us take a look at how we as a organization, Riverside, can partner with the local authorities and local agencies to help fight this growing epidemic. And partnering with the police departments has been a great avenue that we have found to help at the source. Many times when a 911 call is made regarding a person who has made an overdose or who has ingested an overdose of an opioid, our first responders tend to be the police, whether it's local police or county police, and partnering with them to be able to have trained professionals or have the police department themselves trained as administrators of Narcan, which is the opioid reversal agent. So somebody who has ingested the opioids, when a injection of the Narcan is given to that patient, it can reverse some of those effects and help that patient until they are able to get stabilized by EMS and brought into the emergency department to, again, further stabilize them medically. And at that point, we can at least work to hopefully give them some information about the treatment programs that we have here at Riverside to at least impact at some level that addiction cycle that the person is in that's brought them to the emergency department. So that's one of the ways that we've partnered, really looking at the cases that have been, unfortunately, the individuals who have passed away within our county, to really take a look at some of the demographics and figure out how, again, we as an organization can start to impact the population. And as we look at this, we really see that the Caucasian, 30s to 50s type male is really the people that are being mostly affected by the opioid crisis here locally.
Interesting.
It is.
So the task force, you've gotten that demographic information, so now perhaps can target some messages and some education in that direction?
Absolutely. We were lucky enough to be able to get a grant that has allowed Riverside to partner again with some of the local agencies and specifically agencies that allow us to do some community education and training regarding addictions and really focusing on, again, that opioid epidemic, but to get information out there for parents, for loved ones to just start to know the warning signs of people that may be utilizing, whether it's illicit drugs like heroin or, certainly the misuse of the prescription drugs, and really start helping them identify what may be a precipitating event that should provoke them to want to bring them in for an assessment.
And if they want to reach out to Riverside, make contact to try to get that help, you've got some information on how they can do that?
Absolutely. So our behavioral health intake department is available 24 hours a day, 7 days a week, and we have qualified professionals every day that can make that referral and assessment. And the phone number that they are available at 24 hours a day is 1-844-442-2551. And again, that's 844-442-2551. Or an easier way to remember that is 844-4-CALL-1. We're just one call away.
They can get that help. Michael Mutterer, Senior Vice President and Chief Nursing Officer, Riverside Healthcare, an addiction counselor as well. We appreciate the wealth of information you've shared today. Thanks for being with us.
Thanks for having me.